Did you know that pregnancy can cause heart problems? If you're pregnant or planning a pregnancy and you have a pre-existing heart condition, get ready to learn how this may affect you. But first, let's take a step back and learn how pregnancy has an impact on your heart and your blood vessels. Your body's going through many changes during your pregnancy, and these changes put an extra stress on your body and forces your heart to work harder. But it's the only way to allow your baby to receive enough oxygen and nutrients. So let's take a look at the changes that your heart will go through during your pregnancy. Number 1, increase in blood volume. The amount of blood you carry will increase during your pregnancy, and your heart will have to pump up to 3 times as much volume that it was used to. Number 2, increase in heart rate. Your heart rate will also increase. It goes up gradually during your pregnancy, and it's the highest by your 3rd trimester. Number 3, increase in cardiac output. This means that the amount of blood your heart pumps every minute is going to increase. By the 34th week, your cardiac output will grow up to 50%. And if you're pregnant with twins, up to 60%. Now, these changes can make you feel extremely tired, dizzy, or lightheaded. You could experience shortness of breath and palpitations, and all this is a normal part of pregnancy. But here's the tricky part. They also overlap with some symptoms of heart disease. So you might be having heart disease warning signs, but think that there's nothing wrong. That's why during your pregnancy, it could be dangerous. It can be hard to tell whether a symptom is normal or if it's something to worry about. Okay, so far I've mentioned the mechanisms by which pregnancy can affect your heart. Now let's talk about how pregnancy can affect your heart, especially if you have pre-existing heart condition. Number 1, a congenital heart disease is a birth defect that affects the heart. There could be a problem with the structure or the way it works. If you were born with a congenital heart defect and received treatment as a baby or even surgery, it's best to talk to your doctor before becoming pregnant. You might feel completely normal. You may not feel any symptoms, especially if your heart defect was mild, but your heart could probably feel burdened with all the extra work during your pregnancy. That's why I always recommend a follow-up with a specialist in congenital heart disease. The most common symptoms that my patients in these situations refer to me are heart palpitations and shortness of breath. Now, there are more than 35 known types of congenital heart defects. The most simple defects have a low risk of problems during pregnancy. It could be, for example, a mild pulmonary stenosis or a small hole in the heart that could be located in the atria or in the ventricles. However, the more complex issues can affect several parts of the heart and how the blood circulates. For example, aortic valve stenosis or coarctation of the aorta, Epstein's anomaly, severe pulmonary stenosis, tetralogy of Fallot, transposition of the great arteries, and the list can go on. All these situations probably required surgery. If you have a heart problem that I didn't mention, I still recommend you to speak to your doctor if you're considering pregnancy, mainly because you face a higher risk of complications. Number 2, cardiomyopathy. It refers to a problem with your heart muscles that can make it harder for it to pump blood. There are 2 main types of cardiomyopathy. There's the dilated cardiomyopathy. This is when the heart chambers grow larger and the walls of the ventricles grow thinner and stretch. And number 2, hypertrophic cardiomyopathy. It's when the heart muscle becomes thickened, making it harder for it to pump blood. It's less dangerous during your pregnancy, but it's not totally risk-free, especially if you had symptoms before becoming pregnant. Now, back to the pre-existing heart conditions. We have number 3, heart valve disease. In order to start talking about heart valves, let me explain what they are. Now, let's think of the heart like a little house. It has walls. They would be the muscle walls in the heart. It has pipes, that would be the heart's coronary arteries. It has the wires and the electrical system. This would be the heart's conduction system, a network of nodes, cells, and signals that control your heartbeat. And finally, it has doors and windows, and those be the heart valves. There are many forms of heart valve disease that can develop during your life. Most of them won't affect your pregnancy. For example, number 1, mitral valve prolapse. It's very common. It usually doesn't cause any symptoms or needs any treatments. However, if this goes along with severe regurgitation, then your doctor may indicate you treatment before you become pregnant. Number 2, aortic valve regurgitation. In this situation, your risk is going to depend on the severity of this regurgitation. If you don't have any symptoms and your heart is functioning normally, then you shouldn't worry. But if you have severe regurgitation and your heart's pumping is compromised, you face a higher risk, and it's probably best to avoid pregnancy. Number 3, mitral valve regurgitation. In this case, your risk will depend on how severe the regurgitation is, how well your heart can pump blood, and whether or not you have symptoms. If your regurgitation is severe and you have symptoms, you might need mitral valve repair before you get pregnant. Every case has to be studied individually, so I strongly suggest you to talk to your doctor before deciding to become pregnant. Number 4, mitral valve stenosis. This is a form of valve disease that can be improved with surgery. You might need the procedure before becoming pregnant, depending on the severity of the stenosis. Some types of valvular disease can be fixed by surgery, so the option is valve replacement. It helps many people live longer and healthier lives, but people with an artificial heart valve need special care during pregnancy. This is because they need to take a blood thinner for life to lower the risk of blood clots, and this can be harmful for the fetus and increase your risk of bleeding during your pregnancy. So if you have an artificial valve, it's very important to see your cardiologist before planning a pregnancy. Number 4, aortic disease. It's a very special case because during your pregnancy, the pressure in your aorta increases, especially during labor and delivery. This extra pressure puts you at risk for an aortic dissection or an aneurysm rupture, which can be fatal. An aortic dissection is a tear in the inner layer of the body's main artery, the aorta. So, an aneurysm is a very similar thing. It's when a part of the artery wall weakens, allowing it to balloon out or widen. And this weakness, along with the extra pressure inside of the artery, breaks the aneurysm and leads to bleeding and bleeding. This can be fatal, and the symptoms are not always clear. You can feel dizziness, lightheadedness, rapid heart rate, and a sudden pain in your chest that spreads to your back. If you have aortic disease or any heart disease and are planning a pregnancy, now is the time to talk to your healthcare provider. Learn your risks and how you can control your heart condition during your pregnancy. And if this pregnancy caught you by surprise, all the more reason to talk to your doctor, mostly to evaluate your risk of complications. And also, he might change your medication to make them safer for your pregnancy. Now, you might not have any of these pre-existing conditions, but being pregnant can sometimes develop some cardiac disease. So let's take a look. Number 1, high blood pressure during pregnancy. It's not so uncommon. It happens up to 10% of all pregnancies. It could happen in the form of chronic hypertension, which means that the patient already had high blood pressure before she became pregnant. It could also happen in the form of gestational hypertension, when the patient starts having high blood pressure after the 20th week of her pregnancy. And it can also happen in the way of preeclampsia. That's basically gestational hypertension that comes along with protein in your urine or any evidence of organ damage. And it can develop into eclampsia. That's when seizures take part in patients that are already going through preeclampsia. All these cases can also happen even within 10 days of giving birth. Now, let's talk a little bit about gestational diabetes. It's high blood sugar that develops after the 20th week of the pregnancy. It affects about 6% of the pregnancies in the US, and it puts your baby at a higher risk of being very large, more than 9 pounds, being born early, which can cause breathing and cardiac problems, and having low blood sugar. Another problem that you could develop during your pregnancy is deep vein thrombosis. Here's why. During pregnancy, a woman's blood clots more easily to prevent hemorrhage during labor and delivery. This also happens because there's less blood flow to the legs since the blood vessels around the pelvis are pressed with the growing baby. Actually, the highest risk happens just after you had your baby, but it can also happen during the whole pregnancy. So if you have deep vein thrombosis, your doctor will most likely prescribe you a blood thinner that's safe in pregnancy. So remember that some complications can happen within 6 months of giving birth. Now I know that during this time you'll be very busy and tired, but it's very important to keep all your appointments. Something I get asked a lot by my patients is, will my heart problems during pregnancy affect me later in life? Well, the truth is, if you had heart problems during pregnancy, you have a more chance of having them later in life. Now, I could bore you with lots of numbers and statistics, but the good news is that numbers only tell part of the story, and they also reflect situations from the past. They don't have to predict your future. So use this knowledge to plan strategies to reduce your heart risk. Talk to your doctor after you give birth and ask him to be screened for cardiovascular disease. So, well, I hope you enjoyed this video. And if you like, I'll be more than happy to answer any questions. Just leave them in the comments below. Thank you for watching. I'm Dr. Carolina Melgar from Sono Health.